Hi, I'm Sophia, and I'm going to walk you through how to inject progesterone and oil into your muscle, or intramuscularly. This method helps the medication absorb into the bloodstream more quickly. These instructions are broken up into 5 quick steps. Let's start by making sure you've got all your supplies ready to go. A multi-dose vial of progesterone and oil, a sterile syringe, a mixing needle, which may or may not arrive attached to the syringe, a needle for injection, plus alcohol pads, sterile gauze, a sharps container, and a clean surface. You may get prescriptions or supplies that use cc or ml interchangeably. Don't worry. They're just different names for the same amount of volume. For example, 1 cc is equal to 1 ml. Before you move on, check to make sure the solution is clear and there are no particles floating around. If you see anything, don't use it, and call your healthcare provider right away for next steps. Now go ahead and wash your hands really well with soap and water. Your next step is to prepare the syringe. A great thing about this medication is that it comes mixed and ready to use. So get started by removing the cap and wiping the top of the vial with an alcohol swab. Just remember to do this every time you reuse a vial. Unwrap the syringe and mixing needle. Then twist the needle onto the syringe and remove the needle cap. Draw air into the syringe by pulling back the plunger to the ml or cc marking that matches your dose. Insert the needle through the rubber stopper and into the vial of progesterone and oil. Gently press the plunger all the way in, which pushes the air into the vial and makes it easier to withdraw. You'll notice the oil itself is a bit thick. Then, without removing the needle, turn the vial upside down. Make sure the tip of the needle stays submerged in the solution as you slowly pull back the plunger to withdraw your dose. Next, remove the needle and syringe from the vial. If your healthcare provider has instructed you to attach a different needle for the actual injection, then keep watching. Otherwise, skip to step 3. Place the cap back on the needle and twist to remove it from the syringe. Toss the used needle into the sharps container. Then remove the wrapper from the injection needle and twist the needle onto the syringe and remove the needle cap. Point the needle up and tap or flick the syringe to remove any air bubbles. Then press the plunger slightly until a tiny droplet of medication appears at the tip of the needle. A droplet is a good thing. It means your medication is ready to go. Now, recap the injection needle, set it aside, and you're all set to move on to preparing your injection area. So there are a few places where you can inject your medication into the muscle. For today, I'll show you how to inject into your butt. You might find it's helpful to have someone else administer the injection. But if you're planning to do it yourself, use a mirror so it's easier to see what's going on back there. To start, select a location that's within the upper, outer quadrant of either side of your butt. Keep track of which side you inject since you'll switch sides each day. And never inject into an area that's tender, red, bruised, or hard. Giving yourself a shot in the muscle can be a bit uncomfortable. So before you start, apply ice or a frozen bag of veggies for a few minutes to numb the area. You might also find it helpful to put the syringe, without the needle inserted, inside your bra or under your arm to warm it up. When you're ready, use an alcohol wipe to clean the skin, about 2 inches around the injection area. Then give it a couple of seconds to dry. Now you're ready for your injection, so let's do it. Remove the needle cap and hold the syringe with one hand. Then use the thumb and index finger from your other hand to firmly stretch the skin around the injection area. Using a quick, dart-like motion, insert the entire needle straight into the skin at a 90-degree angle. Then, hold the syringe and gently pull back on the plunger just a little bit and look for blood in the syringe. This doesn't happen often, but if you do see blood in the syringe, do not inject the medication. Instead, withdraw the needle right away. Cover the area with a gauze pad and apply pressure. Toss the syringe and needle into the sharps container and start over. If there's no blood in the syringe, keep going and slowly push the plunger to inject all of the medication. Press down firmly on the injection area with a gauze pad and remove the needle. And you did it! Nice job! Now your final step is cleanup. If there's progesterone and oil left in the vial, replace the cap and store it in a safe place at room temp. Just be sure to use it before the expiration date or within 28 days after it's been opened, whichever comes first. Then go ahead and toss the used needle and syringe into the sharps container. And that's it. Thanks so much for watching today. Take care.